Iberdomide is a drug that is sort of what I call the son of pomalidomide, in the sense that it is now the fourth generation immunomodulatory drug, although because its effects are so potent on immune cell function, it's now being called a CELMoD. And we know that in many ways it is far more potent than either lenalidomide or pomalidomide. I have previously reported on the combination of Iber plus Dex, demonstrating about a 30% response rate in triple-class refractory myeloma. And what we're showing at ASH this year is the first report of Iber plus Bortezomib and Iber plus dara. And I think there are a couple of important features about both of these. In both of these subsets or analyses of these cohorts, the median time from diagnosis was about 7 years. Almost half the patients in both of these cohorts were quad-class refractory, which again is a very resistant subset of patients. And more importantly, patients were able to tolerate the combination of Iber with dara or Iber with Bortezomib relatively easily. I think it's also important when we begin to look at adverse events, there was nothing really significantly different between the two. And when we begin to look at responses, the Iber plus dara Dex cohort had an overall response rate of about 42%. Again, keeping in mind that 26 of those patients were IMiD refractory and 15 of those patients were dara refractory, and an additional 13 were quad class refractory. And if you look at Iber plus Bortezomib and Dex, the overall response rate was about 60%, again, with similar proportions of patients being PI refractory, Bortezomib refractory, or quad class refractory, with many of these patients achieving very deep responses. So what I think this trial really speaks to is the fact that the combination of Iber, a sort of novel CELMoD, more potent IMiD, with either a PI or dara is able to overcome PI or dara resistance, likely through enhancement with this CELMoD. And this really portends nicely for future combination trials with this agent.